Hi, this is Dr. Ishizuka from lifetrack.com. Today's subject is how to cure post-traumatic stress disorders with LifeTrack therapy in 6 months or less. This is an abbreviated version of the similar presentation. The cause of post-traumatic stress disorders can be explained by this diagram. When life-threatening events or catastrophic trauma takes place, past experience and current capability to cope is far exceeded by the stress at the threshold, and the mind sends out the normal stress symptoms such as anxiety, anger, physical symptoms, depression, and psychosis. And in case of post-traumatic stress disorders, the dramatic nature of the event pushes the person out of shape, bringing the threshold way down, and the threshold becomes fixated, so it seems, so that little or no trigger or events, provocations, would unleash out of proportion intense symptoms, usually a combination of those 5 symptoms, and making post-traumatic stress disorders difficult to separate from anxiety disorders, explosive anger, physical symptoms, and depression and other psychiatric disorders. Personality determines the threshold at which the symptoms is provoked. Now, the personality can be defined as the way the person thinks, feels, and acts about oneself in close relationships such as in marriage and comparable relationship, and at work or in competitive, productive, creative activities, which brings us satisfaction and sense of meaning in life. Now, how can we raise the threshold? By changing the personality. Since basic problem in post-traumatic stress disorder is that the threshold has been brought down much lower than it should be and is fixed. Now, to do that, first we have to define the personality in such ways that it can be measured repeatedly and consistently. And that data has to be graphically tracked so that we can analyze subtle changes in personality to direct the course of treatment. And then intimacy sphere has to be the first place where we focus our effort to make a breakthrough, allowing self and achievement spheres to stagnate until symptoms disappear and self and achievement recover and converge on intimacy at much higher level. That process of personality transformation usually goes through 4 stages. The first stage is when stress is high, the black line, and intimacy sphere is generally scored higher than self and achievement spheres. And during the second stage, intimacy alone begins to rise above previous maximum of 10, in this case reaching 25, while self and achievement continue to stagnate, dipping repeatedly, absorbing the brunt of symptoms as they rise. Until symptoms begin to dissipate and disappear, self and achievement also begin to rise above 10, eventually catching up with intimacy, converging fully, in this case at 40, 4 times higher than ever, according to his own self-assessment. And beyond that point on, 3 spheres continue to rise with little or no therapeutic intervention. That is the 4th stage. Now, Harry was a typical case of a dramatic post-traumatic stress disorder. He was held up at gunpoint at the local laundry store 2 weeks earlier. When he turned around, he found the gun pointed between his eyes, and he was convinced that he will be shot to death on the spot, and he became incontinent. And he developed severe anxiety attacks, startled reactions with pounding palpitations. He was unable to be alone anymore and couldn't sleep and always exhausted. He was nauseated, vomiting, with chest pain out of control. And he had shaking knees day and night and could not ride subways because some passengers would remind him of the assailant. He would immediately have a panic attack. Now, life drug therapy of Harry proceeded as follows. He came to New York on business assignment alone because his girlfriend did not agree to marry him, which he had hoped that she would, so that he could come with the bride. But he was alone in New York and ended up developing post-traumatic stress disorder. He was hesitant to ask his girlfriend to participate in therapy, so with his permission, I explained to her that it was important that she participates, and she did agree and participated in every weekly session after the first week. And the therapy focused exclusively on bringing them closer together, guided by daily self-rating by both of them on 41 parameters and graphic tracking of their progress during each session, analyzing, interpreting, and the session lasted typically 2 hours and for 6 months. Now, this graph is a tracking of Harry's symptoms during the first months. During the first week, symptom did not diminish at all, although he was put on antidepressant Prozac and another antidepressant was a sedating effect to help him sleep at night, trazodone, and the benzodiazepine for anxiety. But those symptoms did not change at all during the first week until 1 week into therapy when symptoms suddenly started dropping. Anxiety green, red is depression, black is psychosis, anger is blue, and pink is physical symptoms. Post-traumatic stress disorders have all the 5 symptoms, and the reason why symptoms started dropping was not the medication suddenly working in 1 week, but on the 7th of May, I had spoken with her over the phone and persuaded her to participate. On the following day, on the 8th, we had the first 3-way session. She was participating by phone the long distance. That's when symptoms started dropping dramatically. And psychosis, depression, and anger disappeared first, and anxiety and physical symptoms were the only symptoms left at the very low level. Now, during the first months, his intimacy struggled its way up close to 10 and then beyond, provoking and overcoming waves of symptoms. As the symptoms diminished by exhaustion, self and achievement started rising above 10, and his intimacy was reaching 36 by the end of the first months. Kim started 1 week into Harry's therapy, and once a week she participated and then tried to get closer to Harry, and her intimacy score went up. The waves of symptom would be provoked and bringing intimacy down along with self and achievement, but the recovery of intimacy took it to a higher and higher peaks, and finally well above 12 already at the end of the first months. Now, by the end of the 8th months, Harry had reached a very stable state, and once resurgence of symptom occurred during the 4th months when he flew to her hometown and met her father and formally asked his permission to marry his daughter. And that was the time when stress came back a little. But beyond that, she agreed, and they were very happy together, and he was stable at work as well, as you can see in stage 4 pattern. And Kim reached high level of intimacy, 60, and the self and achievement were rising well above 10, showing that she was at the end of stage 3 in the personality transformation process. Now, in treatment of post-traumatic stress disorders, it is key to involve the partner if the patient has one, because patients with partners did 4 times better than single patients, not just in post-traumatic stress disorders, but all the other similar converging psychiatric disorders, including borderline personality disorder. 15.2% reached or exceeded 10% when they came without partners, while 61.4% did the same when they had partners, 871 patients. And outcome of therapy jumped When couples persisted beyond the first months, nearly 80% of them reached or exceeded a previous maximum of 10. And when they persisted beyond second month, 83.4%, and beyond the third month, 86.6%. Condition for success of the LifeTrack therapy depends on the following factors. The first, patient is suffering enough, thus motivated to change. An appropriate partner, committed partner is available, and the three-way teamwork is maintained for several months, and guided by daily self-rating and graphic analysis of progress. For more information about the LifeTrack therapy, please call or visit the LifeTrack website, lifetrack.com, for more information. Thank you for your attention.